powder, you only have about 20 or 30 minutes to give the vaccine. So, you know, if people are coming into the pharmacy, you know, they say, well, I want to go take this to my doctor to give me the shot, you know, they have a very little time to get in their cars and get to wherever they're going and get the nurse to give them the shot. So we do all of that, and that particular drug is set up to specifically be billed as a prescription and not have to be hand-billed or, you know, done as a vaccination through, you know, a doctor's offices. I don't know how they bill those, but we can run it through just like we would, you know, a tablet, a capsule, or whatever. So we do a lot of vaccinations at our pharmacy.
Yeah, could you talk a little bit about like what classes you take in pharmacy school?
Oh, sure. Like I said, it's probably a little bit different now than when I was in school, but you know, certainly pre-pharmacy was, you know, just all the different chemistry and biology and that kind of stuff. But you take a pharmacology class, you learn all the different mechanisms of action of the different medications, how they, you know, work, you know, through the different organs, how they are metabolized, things like that. But mostly the mechanism of action. You take pharmacokinetics, and that is more calculus involved, and it kind of talks a little bit more about what we're talking about here. And that gets involved with, like I said, different equations and how, you know, the drug gets into the bloodstream and the different blood values and stuff. As far as the chemistry is concerned, you do a lot of chemistry. Of course, you had basic chemistry as pre-pharmacy, probably some organic chemistry, but then you take medicinal chemistry, biochemistry, you take pharmacognosy, which is where you kind of learn more about drugs derived from plants. So you kind of get into little plant, which a lot of medications do come from plants, so you kind of get into that. It's anatomy and physiology and microbio are probably considered pre-pharmacy now, I would assume. You get into clinical studies, which I found to be the most interesting, and that's when you basically, you know, are given a case study. You know, here's patient X, you know, she's 52 years old and she has a history of this, this, and this, and this, and here's her list of medications, and you know, you get to evaluate, you know, make changes based on what you see, and that brings me to another area of pharmacy, consultant pharmacist. That is a very big area too. Consultant pharmacist will go into nursing homes monthly. If you're a consultant pharmacist, you have to do reviews at least once a month. You'll go to a nursing home and you will go through their charts. Polypharmacy is really, really a big issue with the elderly patients. You'll see people on 12, 13 different medications. And a lot of times they're put on one medication due to a side effect from another medication. Very, very common. You'll have somebody where, you know, medication is, you know, causing them dizziness. Oh, they're having dizziness. Let's give them some meclizine for their dizziness. We see things like that happen all the time. And so it's a chance to kind of evaluate the patient's profile, make recommendations to the doctor. You know, this needs to be changed, this needs to be taken off, they don't need to be on 2 of these or whatever. So consultant pharmacy is a very big area. A lot of people really like that. Of course, you got some traveling involved, going from place to place, but that's another area. So that's one of the neat things about pharmacy is that there are so many different areas that you can go into. It's not just all retail. Salaries. Nobody asked me about salaries. I can't specifically tell you other. Like I said, all my reports I get are from Purdue. So unfortunately, I can't tell you about, you know, what kind of things are coming out of MUSC, or, well, I guess it's now called the South Carolina School of Pharmacy, with the Columbia campus and a Charleston campus. But I would say roughly that the highest paying pharmacists are the chain retail pharmacists. I don't know if it's just due to all the stress. if it's due to what, but anyway, I would just estimate that they're probably getting paid, I don't know, $55 to $60 an hour possibly. We're looking at probably $110 to $125,000 a year. Those that are desperate, that'd be your your areas that really need to be staffed. I've had students, we get rotating students come through our pharmacy all the time, 4th year students from MUSC, 3rd year students from wherever. And a lot of the students tell us that those that are really recruiting, they'll do everything from giving you sign-on bonuses to paying for housing up to a year. I mean, really crazy things. So that's going to be your highest, paying job is most likely going to be the retail chain. I don't know nuclear pharmacy. I don't know how they come in. Independents, because we're independently. My pharmacists, they own the store. They own the drugs. We're not operating under an umbrella of a chain, and so independents do typically pay less than the chain pharmacy does. Also, hospital, is also a little bit less, and research is, probably depending on what level you're at. But a lot of people like to go after the chain pharmacy due to the high reimbursement rate. I would just tell you too, you just have to, pick out an area where your heart lies and, what you're comfortable with. I would not be in retail if I did not have the opportunity to counsel and be with the patients a lot. That's to me is my favorite part. When I have an elderly man come in and need my help because he doesn't know what to do about this or that, I'm able to step in there and personally help him. That makes all the difference to me. And if I was to be placed somewhere where I was kept or prohibited from doing that, I wouldn't work there. So that's just it's kind of one of those things that you have to kind of decide for yourself. Where does your interest lie? Are you more of a people person and you want to do something like that? Or are you more comfortable, in research? I love hospital. The only downside to hospital is that you don't have as much patient interaction, although you will find that in the hospital setting that they're usually, depending on the hospital, are programs in place. Like if you have a patient discharged on Coumadin, a blood thinner, sometimes hospital pharmacies will have a pharmacist go up and do a discharge counsel so that the patient is aware of what to look for signs of bleeding, things to avoid, medications to avoid, foods to avoid going to extremities on, things like that. So.
What are your hours like in retail?
Good question. Sometimes they're crazy. When I worked for Kroger's, we were open from 8 in the morning till 9 o'clock at night, Monday through Friday, 9 to 9 on Saturday, and like 10 to 6 on Sunday. And there would be many times where we would work 13-hour shifts. At Hubbard & Young, we're independent. We set our own hours. We're open from 8 to 6. Monday through Friday, we're open for 4 hours on Saturday and closed on Sundays.
Does that mean you're working every day that it's open?
No, because I work part-time, which is, an advantage for you women out there. If you are planning on having children and not doing something full-time once you have children, my gosh, this is like the field for you because there is such a demand. Rob and Ron, they like to go on vacation. Well, who's going to help out the one that's left behind when one of them goes on vacation? Me. So I do work every day when one of them's on vacation, but other than that, I work about 18 to 20 hours a week. They have it. It's kind of nice the hours I work because I work Thursday afternoon all day Friday, and I do the Saturday shift. So then they take turns so that, one of them gets a long weekend every other weekend. And it kind of say it just depends. When I worked at Kroger's, I had 2 other female pharmacists that worked with me, and so we worked every third weekend. It's just going to vary. But another trend is that you'll see Walgreens now, and other places that maybe not every store is a 24-hour store, but they will have 24-hour pharmacies where, people have to work that late shift. So, and it's one of those things too that I've seen with chains. If you're able to get hired right into a store, that's great. But sometimes you're not. Sometimes they hire you for an area, and you float in an area until you get to be assigned to a store. So one day you might be working at this pharmacy, one day over here, one day over here. Thankfully, the computer system is the same, but your people, your help, that really varies. So, not a situation I'm really comfortable with, but I was very fortunate that I didn't have that with Kroger's, and of course I don't have that now. So.
Can you say anything about the attrition rate for us pharmacists? You go to pharmacy school, you do this, you do it for 2 years, 5 years, 8 years. But how many people decide that this is maybe not for them, or is it a value or data on that? Or?
I have not seen anything on that. I'm sure. I think a lot with pharmacy, because there are so many different areas, you will tend to see people moving from area to area. If they don't like retail, well, then they're going to take a shot at hospital. The thing is like with me, I've been out of school for 20 years now. As much as I loved hospital as a student, it has been that long since, I have worked in a hospital. If I would ever, go and try that again, it would scare me to death. I'm sure I'd have to go back to a lot of, in-house training, because I've just been away from IV drugs for that long. It would be very scary. But I think most people, probably decide in the first few years, what area they're comfortable in. But yeah, that's a good question. But I have not seen any data on that.
Could you talk a little bit more about the rotations and maybe the ones that you did?
Like I said, I worked at a small hospital, initially a 200-bed hospital. Things were pretty quiet there. Now every pharmacy is set up different, and the technology, my gosh, has changed, tremendously since, when I was there. But, every patient back then would have a little drawer with their medicines, and, the hospital pharmacist would take out and see how many were used and replace them, based on the, the doctor's orders and stuff. Make up IVs. There would be a lot of stuff you'd have to do on the floors, because we would also be in charge of all the sterile waters, all the salines, all the IV bags that they would just hang that didn't have drugs. We would be in charge of all the narcotics, so we would go up to all the different narcotic carts on all the different floors, sign off on all of that, restock all of those. It just, I said the jobs, kind of just varied. My little pharmacy, the little hospital I was in, had satellite pharmacies on the different floors, which was really kind of nice, because then if somebody on third floor all of a sudden needs something right away, they can come to the satellite instead of waiting, for it to come up from. Pharmacies and hospitals tend to be in the basements for some reason. I don't know why, but instead of waiting for it to come up, they could just come to the satellite pharmacy, and we would always have a pharmacist in each of those satellites in the hospital. Like I said, the big hospital that I worked at, it had a psych unit, so that was a whole another thing. We had to service the psych unit. We did a lot more IVs. We had a technician that would just do small